may invite the innovative Professor Sando Lovaz, who was a practicing urologist at the biggest department of urology at the Budapest Semmelweis University. He is innovative in many ways. We have seen him at GIBS in the last 6 years and looked at establishing new ways of measurement and new equipments, right from the urodynamics and the upper urinary tract, to his recently invented 2 devices for catheter-free bladder installation, an assisted device for self-instillation. That's a great leap forward in reaching self goals, what was told by our friend Dr. Lee from Taiwan. So that self-motivation and self-realization of a subject where we can make patients more comfortable. Dr. Sando Lovaz, the stage is yours. Welcome with the innovation, please.
Thank you. So I share my screen and I would speak very briefly about the present situation and maybe some words about the future of ICBPS in Hungary. Well, the first slide, the present status, is a dark slide because the situation is quite terrible in Hungary. There are a limited number of therapists who are specialized treating interstitial cystitis, and over 90% of the diagnosed cases are treated in a single center. That's not a good situation. There is a low interest of young urologists in research or dealing with interstitial cystitis, and there's a complete ignorance of the disease by gynecologists and GPs. There is no working cooperation with other specialties and no reimbursement for the treatment for the patients. Therefore, it is very, very expensive. But maybe the future and some hopes we have, this slide is already a little bit lighter. We propose some improvements in this condition. We have to improve the detection rate. Therefore, we can use the social media in a wider way. Teaching courses for urologists, gynecologists, and GPs should be organized naturally, first of all, after the COVID era, because now all other doctors are overlasted. To improve the number of therapists, this is also a very difficult point. Publications, reports, presentations should be done, but young urologists are mostly interested in other topics. To build up working interdisciplinary cooperations, we have to do and perform common research on adjusting areas of other specialties. This could bring us together and work out a really live cooperation. To improve the diagnosis and efficacy of the treatment, this is an option, what we can do, and we did already in some steps. I will present it very briefly in the next slides without explanation. That's just a listing. A gag layer integrity test was developed a few years ago, which is based on voiding urinary diary. It is non-invasive and gives a quantitative result. Therefore, it is applicable for diagnosis, for follow-up of the patients, and also for objective defining the efficacy of the treatment. We integrated the Beck's depression inventory into our first evaluation of the patients, just to screen the patients for serious level of depression. And by using this, we hope we can prevent such tragical situation, which can often happen, that patients have a high tendency to perform suicide. A urine alkalizing agent was developed in the last year, a special one, which is a controlled release drug. It takes 12 hours, during 12 hours it is effective. It is potassium free, which is very advantageous for IC patients, and the patient's compliance is high. There's an optimized bladder cocktail developed in the last 5 years, step by step. We use different, the special mixture of gag layer compounds, And our mixture is non-irritative, it's isotonic, and it's available in compound pharmacy in pre-filled syringes. When we continue this line, then we can say the syringe adapter for catheter-free installation was presented already at the GIBS meeting 3 years ago, but it's now going well known in Europe and in many other countries as well. It replaces the catheter, it is pain-free, it's easy to use, and improves the quality of life of patients enormously. And then we developed on this basis an assistive device for self-installation for female patients. By using this device, they can very easily identify the orifice, and under visual control, they can perform the self-installation without using a catheter. And this reduces the expenses enormously because the patients do not have to travel to the doctor. They can perform it at home. A continuous follow-up system is available, which is an internet-based software, which makes it possible that the data of the patients on long term are collected and build up a database. And based on this database, an automatic generation of diagrams is performed, can be seen immediately how the patient is doing, and objectively presents the tendencies as well, because in a long term, we see if there is a tendency of improving or worsening or whatever. And based on these results, on these generated diagrams, we can individually tailor the therapy. So not everybody gets the same treatment, but we can adjust the treatment according to their situation, actual situation. And finally, just a picture about this urodapter, this small tiny adapter, which makes minimally invasive the intravesical installation. And as we performed in the last 5 years, this treatment which we performed already 3,500 times. So we have enough experience to say that this is the only way which makes possible a simultaneous treatment of the bladder and the urethral mucosa, because most of these patients have also urethral pain. There's no need of catheterization for installation, therefore there's no mechanical lesion of the urethral mucosa, and therefore the treatment is completely pain-free. It is quick, simple procedure, and more patients would like to have this solution. If you would like to hear or read more about these different topics, you look at the home site of Eurosystem.com, where you find details, and we would be very glad really if you would be interested in any of these topics. We can work out a cooperation, even maybe some common research in the future. Thank you.
Dr. Sandor, those innovations have actually stood tall for the community of urologists and gynecologists and pain therapists who are actually deeply involved in this subject. So thank you so much for that.